A very good evening to all of you. I would like to compliment Business World Healthcare for organizing this wonderful event, more so Mr. Narula for inviting me to be here. It's a great pleasure to be among such enlightened audience and distinguished guests. I really enjoyed the couple of sessions that I went to. And there are many take-home points. I don't want to repeat them. I think our MC has already given us a briefing on what are the take-home points of the sessions we had. Organizers of the event, distinguished guests, participants of this program, it was a great honor for me to chair the jury of many, many eminent personalities across the country, and it was a great honor for me to work with all of them. Without further ado, I move on to my keynote address on the future of healthcare and the role of innovation and technology. If I may have the next slide, please. Is the movement here?
Yes.
This one?
Yes.
Green one. So we'll talk a little bit about the future of healthcare, and I'll make sure I stick to the time given to me. I always, whenever I'm in an audience, I tell them that they need to know what Noel is. Noel is something that is nodding off episodes during a lecture. And I believe it's directly proportional to the time that the person who's speaking is in front of the mics. And I'm told the maximum time before someone nods off is about 15 minutes. And that's if you've had coffee, and if it is post-lunch, it may be 2 minutes. So we'll certainly stick to the timings given to us. Healthcare has come a long way in the last few decades for sure. I've been in healthcare more than 5 decades, so I've seen many of the rapid changes that have happened in the field of healthcare. I do remember the days where my grandmother had to have gallbladder surgery, and fortunately for her, her son was the district surgeon of a well-known district called South Canara those days. It was an old, dilapidated hospital, even though it was the district headquarters hospital. She had a foot-long scar, 3 weeks of stay with the family in the hospital, and that has now given rise to a keyhole surgery, laparoscopic surgery, and we even now have surgery through the natural orifices. We at Manipal have done a nephrectomy through the vagina where there's absolutely no scar in a given patient. So this lady wanted to donate a kidney to her sister, and she was very keen that she doesn't have any scars. So we removed the kidney laparoscopically through the vagina, and there were no external scars, and transplanted it to the sister. And fortunately for us, both the recipient and the donor have done well. The question I need to ask all of you, is this enough though? Is this progress enough? Would you fly an airline that has a Boeing 747 crash every day? Obviously I would not, and I'm sure many of you wouldn't. Would you shop at a store where the prices are not posted? Only when you pay the bill you know the price of the product. Would you go to a bank where ATM transactions would take days or longer instead of a few seconds? Would you check into a hotel where it takes a minimum of 6 hours to check out? And the answer to me, to all of these questions, is a resounding no. But unfortunately, we still accept this in the field of healthcare industry. If you just look at the number of deaths because of medication errors, it's over 100,000 in the US. That's more than one Boeing crashing a day. And we still go to hospitals in the US. You like it or not? Not that we are any better. The future of healthcare would be very different from what we know now. In most instances, brick and mortar hospitals will be replaced by technology-driven healthcare services. It will be an era of smart hospitals. Unfortunately, the medical fraternity and the hospital industry has woken up very late, and it is only recently that we are seriously looking at smart digital hospitals. I'm sure all of you recognize this figure. In my mind, the greatest innovator of modern times. He said, "A place where technology and design converge to enhance patient care is what a smart hospital would be." The changes that we are looking at is certainly where you had long queues outside your bank with tellers taking one customer at a time, and now you don't need to go to the bank at all. To be honest with you, I have not been to the bank in more than a year or two for many reasons, but certainly one is you wouldn't want to be in this queue. So also in airlines, you don't have to stand in queue. You have self-service kiosks where you can check in, go to the security check and move into the aircraft. Of course, I still remember these phones, and I still remember the trunk calls we used to make to the US. I had some family in the US, and you would book the call, and sometimes it would take 3 days to get the connection. And then you had what's called as a very urgent call where they would get the connection in 12 hours. And the entire community would be knowing that you're talking to your brother or sister in the US because you had to shout, as if you literally had to carry your voice across the continents to be heard. And that's been replaced by this lovely phone, which I think has replaced everything, computers, cameras, so on and so forth, but also has changed our social behavior. Now you sit at the dinner table and the children don't talk to you. They're always looking at the phone, and if they want to communicate with you, they send you a message or a WhatsApp message. So that's the tragedy of technology, but we have to live with that. And this is Steve Jobs when he was young and before he died. And you can see the change in the computers to the iPad. And this is the change that we are looking at in medicine. And this is what I would call as an intelligent and smart hospital, where everything is streamlined, interconnected, portable, non-invasive, high-tech systems of the hospital of the future seek to improve patient outcomes, eliminate waste, and help reduce costs and errors. What are we looking like? And we are already seeing some of these in many hospitals. Registration kiosks, where you don't have to interact with any person, you can register on your own. App-based appointments and billing, this is happening in many hospitals, where you use an app to get the appointment, get your billing, and also get the feedback of your records. Location and tracking devices, so that sometimes you leave the porter leaves the patient in the veranda and then goes for a coffee, and no one knows where the patient is. So you have to send a whole army of people to track the patient and the porter. Electronic status boards, especially outside ICUs and OR, so that the anxious family knows what's going on. Technology that travels, I think now more and more we get involved with home care, with monitoring devices where you can remotely monitor patients. They don't have to come to the hospital just for that. Charging stations, digital pharmacy, digital dietary inventory. Now, digital pharmacies, I think, have made a big difference. Now, most people do not have to go to the pharmacy to get their medicines. They can order them. So the fact that has changed is you don't have to go to get a service. The service will come to your home. And that is the change that we are looking at. At Manipal, we view it wearing two lenses. One is for the patient, other one for the doctor. From the patient's perspective, I think the key challenges are affordability. Technology cannot be awfully expensive where it is not possible for the patient to afford it. Accessibility continues to be a challenge for a majority of our population. However, I think the COVID sort of speeded up our accessibility in remote areas. Just to give you an example, I used to have a patient who comes every 6 months to see me from the most remote area of Assam. It would take him 2 to 3 days to come to Manipal Hospital, spend half an hour with me, and another 3 days for him to go back. And all that I would do is say hello to him, check his labs, and be done with it. So because of COVID, he could not travel, and he had a very smart granddaughter who actually had a laptop, and they were able to get the connection in his house, and she had a teleconsultation with me. I spoke to him, said the usual things, and she had also had a lab service where they would collect the lab from that remote town, bring it to their main center and get the labs done. So I had all the information I needed. What was surprising to me is I suddenly saw some movement behind him. So, and this place looked very remote, and he was sitting on something like a charpoy. So I was wondering if some animal has come into the scene or something like that. But then it turned out he was in a cowshed on a charpoy, talking to his doctor hundreds or 1,000 miles away. And he saved a week of his time by this telemedicine consult. And that is the kind of change we are looking at. There is absolutely no reason for this man to come and say hello to me, and spend a week on travel. We certainly would like to improve the quality of clinical outcomes and customer experience. Some of the initiatives we have embarked upon are remote monitoring devices of various kinds to check your vital signs, sugars, as was mentioned earlier, continuous glucose monitoring devices, home care, outpatient and day care, diabetic management systems, e-ICUs where you don't have to have a qualified intensivist, which is difficult to get in every hospital. Step-down ICU, sometimes your stay gets extended and it's awfully expensive to stay in the ICU. If you had the choice, you would probably stay in a suite at the Taj or the Leela rather than the ICU because it would cost you less. So step-down ICUs, we have many monitoring systems like the ISNSS system that we use to monitor heart rate, respiratory rate, oxygen, BP, temperature, etc., and alert the need for immediate attention. Believe it or not, this system has significantly reduced the number of code blues or sudden deaths that we see in the hospital. Because when the patients get sick, we are alerted and someone goes and takes a look at them, and if they are very sick, does the needful to move them to the ICU and get them out of their acute illness. Of course, robotic surgeries were introduced by us many, many years ago, and it's something that we constantly do. And as our population is aging, many people have moved to elderly care centers because of nuclear families. And the elderly obviously are more prone for different kinds of illnesses and issues. And it's very difficult for them to come to the hospital for every small illness. So we have elderly care monitoring devices, which is monitored by our geriatric specialists. And that has considerably reduced not only the morbidity, mortality, but also the visits to the hospital. E-consultations are very common now. This improves the accessibility for patients. They don't have to come all the way to the hospital for follow-up visit. And I must actually thank COVID for this. For decades together before COVID, we were just not able to get teleconsultation off the ground because of legal and regulatory issues. But 1 week, the last week of March of 2020, when COVID started, this was all sorted out and teleconsultation became a reality. Certainly, we'd like to improve patient experience through initiatives like online appointments, which are routinely done, monitoring discharge processes. No one would want to like to wait in the hospital for hours together after the doctors have told them you can go home. We have launched a mobile app where patients can get their clinical records, book appointments, and make payments. Some time ago, I had the opportunity to participate in the Lake Nona Impact Forum in Orlando, Florida, and had the privilege to see firsthand the future of healthcare. Of course, this is a beautiful city that it was. And some of the take-home messages from there is that I truly believe that our generation is blessed to be witnessing the greatest scientific and technological developments ever to happen in the history of mankind. These are my predictions. If you are still with me in 2040, we can decide whether these predictions were accurate or not. And I'm sure I see a lot of young people here. I think many of you will be there in 2040. I do not know about myself, but hopefully I'll be there too to see if these predictions are true. It's obvious that there is going to be a paradigm shift in the way we deliver healthcare in the future. In my view, healthcare is going to shift in the following ways. From illness to wellness, I think many of our speakers very eloquently spoke about how to maintain wellness. Don't wait to become sick. Keep yourself well rather than become ill. From hospital care to home care, I do believe hospital is not a good place to visit. So you should only visit hospitals if it's absolutely necessary. Some procedure is needed, surgery is needed. Most of the other things I think can be done at home or with a very short hospital stay. As I said earlier, a month's stay in the hospital for a gallbladder surgery to maybe 24 hours of stay now. From primary clinics to e-clinics where a robot will check you up instead of a doctor, and this is already happening. From conventional capture of vital parameters and lab checks to smart devices either implanted or attached, which monitor and transmit data real time for interpretation, and at times based on the pre-programmed recommendations would also suggest remedial measures. This is not fantasy, this is already happening. From conventional pharmaceutical medications to to pharmacogenomic therapy based on the individual genomic characteristics with nano-delivery systems for targeted therapy, from absolute despair for people with genetic diseases to early detection and complete cure through genetic modification and gene therapy. And this is already happening for Fabry's disease and many other kinds of genetic diseases. From conventional organ donations to growing organs in the labs, this has already started using stem cells, and tissue engineering techniques and 3D printing of the exoskeleton of organs. I'm somewhat disappointed that even though these things have been up in the air for over a decade, it's still not come into clinical practice. I'm hoping something drastic will happen in the next few years. From a regular doctor checkup and survival prediction to a simple test to check your telomeres and predict your lifespan. I think there's a 1,000-pound test in the UK, if I'm right, which can actually predict how long you're going to live. From regular surgeries to remove, fix, or replace an organ to injection of stem cells and gene transfer through vectors for self-healing. Stem cells have already been approved. We are proud that our company, the Stemputics India, has 2 products now that has been approved by the government, one for osteoarthritis of the knee and the other one for Berger's disease as a part of cell therapy in diseases. Your surgeon could be miles away directing the robot to do the job, but we still like the surgeon to be close to you when they're doing the surgery, because people do get an impression that the robot is doing the surgery and not the surgeon. If you think this is my flight of fancy, as I said, please read my predictions again in 2040. And if you thought doctors will become obsolete, don't worry, we'll still be around directing the computers and artificial intelligence for wellness rather than to treat illness. We are at the cusp of entering an exciting new era of practice of medicine, and India, with its intellectual capital, technological resources, medical device manufacturing, biosciences, and pharma industry, will be the most suited to enter this new era with a bang. In conclusion, healthcare delivery of the future has thrown up some very exciting challenges, and it is likely to turn our conventional wisdom topsy-turvy. Unless we, the healthcare givers and the planners, adapt to them early, we will perish in the storm of technology and innovation. We will be like this cat who ate the wrong mouse. So, ladies and gentlemen, thank you very much for giving me this opportunity. It's a pleasure to be here. All the best. God bless.